Tummy tuck surgery in massive weight loss patients एक बहुत difficult surgery है. The reason for that is the amount of skin that is extra hanging down, potential blood losses, that means blood transfusions की requirement. Massive weight loss patients में vitamin deficiencies होती हैं. आजकल बहुत सारे patients are already on Mounjaro or Ozempic, so that itself is another problem. And then because these are long surgeries, recoveries are also long, fluid shifts, maintenance of sodium potassium balance. So all of these challenges are to be kept in mind. Now, the second major challenge for us is what is the surgical procedure to be done in a massive weight loss patient. So for example, you can see that this much of skin, she's lost about 60 kgs of weight. This much of skin is hanging. Now, what are the options for us? First is we just do a simple tummy tuck. So the tummy tuck is passed from here till here, we remove whatever is the extra skin and tighten everything. That will only give her about 60% satisfaction because there's a lot of extra skin on the back, and unless we go across to the back in what is called as a belt lipectomy, it is not going to solve the laxity of skin on the back. That is why it only gives you about 60% of the satisfaction. So if you do a belt lipectomy, it is a better procedure because there's so much of extra skin on the back as well. Now there's an interesting procedure called the fleur-de-lis procedure. What is that? So in the fleur-de-lis, I think that is a procedure which has the maximum satisfaction rate. I'm going to show you what that is. So we are going to remove this much of skin that we have already marked. So this much of skin is going to be removed. Second part of the procedure is to remove skin like this. Like this. That means the laxity on the sides is also taken care of and the skin is brought in like this. There's also a lot of looseness here which will not get pulled down, and that also is taken care of by this procedure. So a lot of the skin on the sides is pulled in. So this is the result. You can see, just see where my mark is. It just gets pulled in like this. See, by more than an inch it gets pulled in. So that is the advantage. If we do this procedure, gives a scar from here to here and a piece kind of a scar. So not many patients unfortunately opt for this, but this is one of the best procedures. We like to avoid it in smokers because of healing problems, and in patients who have severe vitamin deficiencies we want to avoid that because of again healing issues. But anybody who has laxity of skin in the upper part or on the sides should consider what is called as the fleur-de-lis procedure, and so it gives a nice tea and we are able to take care of the maximum amount of laxity, and this is a procedure which has the maximum satisfaction rate.